There's a moment that happens in millions of homes every single day. A husband notices his wife is more breathless walking up the stairs than she used to be. A daughter calls her father and he sounds tired, swollen around the ankles, slower to answer. And in that moment, almost nobody thinks the words heart failure. They think getting older. They think just tired. They wait. And that waiting, that quiet, well-meaning waiting, is exactly why so many seniors get this wrong. Here's the truth nobody tells you plainly enough: heart failure and cardiac arrest are not the same thing. They are not two versions of the same emergency. They are two completely different stories, with two completely different timelines, and confusing them can cost you the one thing you can't get back: time. Let's start with heart failure, because this is the one that hides in plain sight. Heart failure does not mean the heart has stopped. It means the heart is still beating, still working, but it has lost some of its strength. Picture a pump that used to push water through a hose with full force, and now it's pushing at 60%. The water still moves. But it backs up. It pools. It seeps into places it shouldn't. That's heart failure in the body. Blood backs up into the lungs, and suddenly climbing the stairs feels like running a marathon. It backs up into the legs and ankles, and shoes that fit yesterday don't fit today. It backs up into the abdomen, and appetite disappears. None of this happens in a single dramatic moment. It happens over weeks. Sometimes months. It whispers before it ever shouts. And this is precisely where the danger lives, not in the disease itself, but in how easily it gets dismissed. A little more tired than usual. A little more swollen. Sleeping propped up on two pillows instead of one because lying flat feels suffocating. Family members see these signs and call them normal aging. Even the seniors themselves explain it away. I'm just not as young as I used to be. But the body is not speaking the language of aging here. It's speaking the language of a heart that is struggling, one beat at a time, to keep up. Heart failure is a chronic condition. It can be managed. It can be treated with medication, with lifestyle changes, with careful monitoring. People live for years, good years, with heart failure once it's identified and respected. But it has to be caught. And it can only be caught if someone is willing to ask the harder question instead of accepting the easier explanation. Now hold that picture in your mind: the slow leak, the gradual decline, the warning sign stretched out over time, because what comes next is its complete opposite. Cardiac arrest does not whisper. It does not give weeks of warning swelling in the ankles or breathlessness on the stairs. Cardiac arrest is sudden. It is electrical. And it is the moment the heart's rhythm becomes so chaotic that it simply stops pumping blood altogether. 1 second, someone is standing in the kitchen, talking, laughing, completely present. The next second, they collapse. No pulse. No breathing. No warning conversation beforehand that says, something is wrong. This is the heart's electrical system short-circuiting, and unlike heart failure's slow erosion, cardiac arrest is a countdown measured in minutes, not months. This is the difference that every senior, and every person who loves a senior, needs carved into memory. Heart failure is a condition you live with. Cardiac arrest is an emergency you survive only if someone acts immediately. Confusing the two, treating a sudden collapse as something to wait and see about, the way one might wait and see about ankle swelling, is the mistake that turns a survivable moment into a tragedy. So what does immediate action actually look like? If someone collapses, is unresponsive, and is not breathing normally, this is cardiac arrest until proven otherwise. There is no calling the doctor's office in the morning. There is no waiting to see if it passes. Call emergency services right now. Begin CPR if you're able, even hands-only chest compressions, pushing hard and fast in the center of the chest, can keep blood moving to the brain and organs until help arrives. If there's an automated external defibrillator nearby, use it. Every minute without intervention sharply lowers the chance of survival. This is not a moment for hesitation, it's a moment for motion. And here's something that deserves to be said honestly, with compassion. Heart failure, left unrecognized and unmanaged, can sometimes set the stage for the very rhythm disturbances that lead to cardiac arrest. They are different events, but they are not always unrelated strangers. A weakened heart is a heart under strain, and strain is what makes electrical chaos more likely. This is exactly why catching heart failure early, naming the breathlessness, the swelling, the fatigue, for what it actually is, matters so much. It isn't just about comfort and quality of life today. It's about reducing the risk of a sudden crisis tomorrow. So if you are caring for a parent, a spouse, an older neighbor, when breathlessness or swelling shows up, don't call it just aging. Call it what it might be, and get it checked. And know, with absolute clarity, that a sudden collapse is never something to watch and wait on. It is always, every single time, a call to act now. Knowing the difference between these two conditions is not just medical trivia. It is the kind of knowledge that changes what you do in the most important 60 seconds of someone's life. Heart failure builds quietly, over weeks and months, giving you a window to notice, to ask questions, to get help before things spiral. Cardiac arrest gives you no window at all, only a handful of minutes where the right action, taken immediately, can mean the difference between a story that ends in heartbreak and one that ends in relief. Think about the people in your life right now. The parent who's been a little more breathless lately. The grandmother who's started sleeping on extra pillows. The neighbor who mentioned, almost in passing, that his shoes felt tighter this week. These aren't throwaway comments. They're the body's early warning system, doing exactly what it's supposed to do, if only someone is listening closely enough to hear it. And think, too, about what you would do in the other scenario, the sudden one. If someone in front of you collapsed right now, would you freeze, waiting to see what happens next? Or would you move, call for help, start compressions, reach for an AED? The seconds you spend deciding are seconds the brain and heart don't get. That decision shouldn't be made in the moment of panic. It should be made now, calmly, while you have the clarity to think it through. This is why understanding the difference between heart failure and cardiac arrest isn't just useful information, it's protective knowledge. It's the kind of thing that turns a bystander into someone who saves a life. It's the kind of thing that turns a worried family member into someone who catches a problem early, instead of someone who looks back later and wishes they had asked one more question. So carry this with you. Heart failure whispers, listen for it. Cardiac arrest strikes without warning, be ready to act on it. Two different conditions, two different timelines, two different responses. And now, hopefully, two pieces of knowledge you'll never confuse again. If this video helped you, hit like so it reaches more families who need this. Comment below, have you or someone you know experienced heart failure or witnessed a cardiac arrest? And share this with someone caring for an older loved one. This knowledge could one day save a life.